Pleasant good afternoon, Madam Presiding Officer, and to all of the majority and minority in the House. Pleasant good afternoon. The minority has brought to us this evening a motion which I'll read. States, whereas the Tobago House of Assembly, Act 40 of 1996, via the 5th schedule, is responsible for all matters related to social welfare, and whereas the onset of the COVID-19 pandemic in 2020 resulted in stay-at-home measures, and whereas there has been an alarming increase in incidents of domestic violence and child abuse directly affecting men, women, and children, be it resolved that this House joins in condemnation of these heinous acts of violence and abuse meted out to citizens throughout the country. And be it further resolved that this House mandates the Tobago House of Assembly to develop and implement strategies to treat with the meaningful engagement of both victims and perpetrators of these incidents. Let me tell this House this afternoon that this motion is late, is very late, because as I sit as Assistant Secretary for Health, Wellness, and Social Protection, I could say beyond a shadow of a doubt that we have been working assiduously to deal with this situation in our beloved island of Tobago. The goodly councillor stated statistics from far and wide, and I don't think it would be of any consequence for me to seek to state also. There is no challenge to the fact that domestic violence constitutes something very heinous and very, very harmful to our society. We at the division have been meeting and interacting with persons in our community continuously for the 5 months that we have been in office. And during those 5 months, of course, they came just at the tail end of the pandemic. We have been able to see where some negligence on the part of those that were before us could be part of the reason for some of these challenges we have in our society. You see, the research on domestic violence would show that most of the perpetrators in domestic violence happen to be men. And when your island suffers a certain kind of leadership, it could filter down right into the society and create a certain measure of frustration. Nonetheless, we at the division are well equipped and seeking to continually improve the quality of service we offer to those who are so affected, both victims and perpetrators. It's part of the structure of governance in Trinidad and Tobago to have proceedings and court hearings from time to time to deal with matters of this kind. And so for domestic violence, we have a family, district, and children court to deal with matters as they arise. The judicial officers are present, and their probation officers to prepare a probation officer's report in order to guide the decision-making process. Parties in proceedings can be adults, children. Risk assessment reports have been requested as far back as 2021 as well, so that we could do a better job as we go forward. We request counseling. We have therapy, mediation services, probation services. All these are done in Trinidad, but in Tobago, the model is a bit different because we have internal referrals where our social workers and social support staff could meet those affected and deal with their different challenges. A supervision a supervision order can be made in which an officer is required to monitor a child in need of care and protection. So the children are specially taken care of. We have judicial officers, judges, masters, and magistrates, or magistrates. They can request investigative reports at any time, and that involves the abuse of a child. And this can be done at any point in the proceedings. Both clients and victims can benefit from interventions and support through counseling, monitoring, rehabilitation through probation, supervision orders, referrals to other stakeholders to assist in their overall well-being, example in treatment and substance abuse. So the motion as presented to us today borders on pretense that nothing is in place. Because if I read it again, it would say, the House mandates the THA, Tobago House of Assembly, to develop and implement strategies. There is something developed already, and there are already strategies in place. The strategies also involve assistance to the perpetrators. We know that once the perpetrators are not dealt with, there is the risk of repeat offense from time to time. Upon request of the court, supervision orders are carried out, clients are monitored, and are referred to counseling. Anger management and drug treatment are also offered. Perpetrators are also exposed to workshops, training, programs for behavioral changes, such as thinking for a change, remedial therapy, case care management. All this is guided by an act, the Domestic Violence Act number 27 of 1999. So this afternoon, we could safely say that the motion presented is flawed, and that as an institution, the Tobago House of Assembly, we stand ready to just improve on what we already have in place to work for the betterment of our citizens. During the pandemic, which lasted 2 years, persons who were so prone and so inclined were involved in many of these heinous behaviors, but it's not something brand new to our environment and to our society. Domestic violence has been around for a very long time. And so it's our endeavor, we intend to do our endeavor best to seek to work with our citizenry, to work with our professionals, to ensure that this scourge is brought under subjection. Despite officers being trained in general counseling, there's a need for specialized training in the area of domestic violence. This was specific to Trinidad, as the officers there provide counseling while we refer to, all right, my apologies, sorry. Recommendation for an assessment tool to deal with the varying types of applicants, that is spouses, siblings, parents, parent-child, etc. This would assist in the implementation of more precise programs and recommendations to deal with recidivism. This was made particularly since the Tobago District Court began requesting risk assessment reports in 2021. Multi-agency forums, agencies working together to assist victims and perpetrators of domestic violence, sharing information and plans, how they intend to deal with families, taking into account the ongoing risk associated with COVID-19. We have social workers who are hesitant to enter homes and do in-depth investigations, and these areas present our greatest challenges. A standard database to capture necessary, pertinent information for easy storage, retrieval of information, and for use by the CSO, the Central Statistical Office. And of course, attention to be given to particular training in assessment and counseling clients with domestic violence issues and matters before the court. What I'm saying in a nutshell is that regardless of what the situation presented is by this motion, the Tobago House of Assembly and the Division of Health, Wellness, and Social Protection is well equipped and seeking to arm itself continually to be able to deal with this ongoing threat. Under the leadership of our Chief Secretary and our Divisional Secretary and Associate Secretaries, we intend to continue to pilot the way towards dealing with this scourge in our society. I thank you, ladies and gentlemen.